Hi guys, welcome to Wellness Wednesdays. This is Beth, one of the midwives at Reply, and this series of questions will go over some of the inquiries that we got from you all regarding fitness and pregnancy. So what I'm going to do is just read through some of the questions that we received, to go over the answers with you, and at the end of our session, show you a few exercises you can do at home with modifications for different physiologic changes that are happening to you across your pregnancy. So one of the first questions we got is, I work out regularly using weights and doing resistance training, and I'm either planning on becoming pregnant or very early in pregnancy. Is it still okay to continue with moderate strength training in pregnancy? And the simple answer is yes. The general rule of thumb that I dialogue with patients about is that if you're already engaged in a certain level of physical activity, it's okay to continue that. And then, use your body as a guide to kind of determine if you need to make modifications. Additionally, the other thing is that you don't want to sign up for something that you haven't already been doing. So if you're not a runner, I would encourage you not to sign up for a marathon tomorrow. Or if you don't lift weights, you don't want to join a CrossFit box. But other than that, yes, as we know, labor can be super demanding, so staying physically engaged across your pregnancy is actually a benefit to you, because labor pushing is probably one of the most physically demanding things you'll ever do. So staying fit and active across your pregnancy is definitely a benefit to you. In regards to exercising in pregnancy, our next question was, if I'm already exercising, can I continue to do so? Yes. Again, with this, if it's more cardio-related activity, certain basic guidelines state that if you are not able to continue to engage in conversation or sing a song, that your rate of perceived exertion, which basically is a fancy way of saying, is this activity too demanding for me? So the general recommendation is you want to stay between a 6 or an 8 on that scale. And because it's subjective, that's up to you. But 1 is an activity that is basically so easy you don't feel like you're working at all. And 10 is an activity that's so demanding you can barely catch your breath. So the recommendation is to stay somewhere between a 6 to an 8, which means you're able to, again, sing, talk, exercise comfortably, not experiencing any shortness of breath, chest pain, things like that. In regards to how much time you can exercise, that kind of depends on the activity. But if it's a moderate intensity activity, it is safe for you to engage in 150 minutes of that activity per day, up to 2 to 3 times per week. If you were minimally active before, if you worked out 5 or 6 days per week prior to becoming pregnant, certainly okay to continue with that frequency and adjust as you need to. Questions about running and lifting weights. So running in itself in pregnancy is totally safe. However, you may have to make modifications based on your comfort during running. Around 10 or 11 weeks of pregnancy, your uterus moves from a pelvic organ to an abdominal organ. What does that mean for you? You're going to have to pee more. So with running, know that it's okay. You may have to take more frequent breaks to go to the restroom. So if you're running outdoors, you do want to, again, utilize a mask for safety if you're going to be on a trail or path that's, more populated than others, as more people are outside right now. And the other thing is, have a quick exit route in case you need to use the restroom, that you can get to it easily. If you have access to a treadmill in your home, certainly, again, safe to do. You just want to be aware of the signs that your body is sending you in regards to intensity, comfort, other things like that. But again, continue to do the things that you have done and listen to your body as a guide. So again, like I said before, there's great benefits to continuing to work out in pregnancy, but what does research actually say? And as you guys know at Reply, you ask, we listen, but we are evidence-based, and we never want to tell you anything we don't have research to back us up with. And I would like to say again, since I failed to mention before, although I love birth, pregnancy, I am a midwife, certified nurse midwife, but I'm not a personal trainer. So if you have a personal trainer or are seeing someone around physical fitness that's certified in that area, definitely take their recommendations over mine. This was just kind of things to help you be safe at home. So a few of the benefits of continuing activity in pregnancy include reduction in back pain. And that's one of the main complaints or concerns that women have as they get more pregnant and your belly starts to grow out more in front of you. Your oblique muscles, pelvic floor are trying to accommodate for that change in your center of gravity. So in turn, sometimes that means you experience back pain. But the more actively engaged you stay in pregnancy with physical fitness, the lesser likelihood that you have of experiencing this symptom, because you're keeping your core well trained and tight. You're developing and continuing to train your lower back muscles, all things that are super useful for maintenance of health, well-being across your pregnancy. Other additional benefits of continued physical fitness in pregnancy include reduced risk of constipation. You can kind of reduce your risk for preterm labor, gestational diabetes, gestational hypertension. If you have chronic hypertension already, it can help you stabilize, along with the inclusion of other activities, medications, anything that you're currently undergoing. But in general, to be healthy is great across pregnancy and in life. So if we can help you adopt healthful behaviors in pregnancy, the time you choose to do it, that's awesome. So good for you. The other things that continued physical fitness offer in terms of benefits to mom and baby are helping you achieve adequate maternal weight gain in pregnancy. And that number is based upon your weight and height entering pregnancy. So again, that's something that you can discuss with your healthcare provider at your new OB visit with Reply, so that we can kind of go over the expectation for weight gain in pregnancy. We can review all of the current level or activities that you're engaging in regarding physical fitness, and kind of determine when and if you need to modify or stop certain activities. Additionally, being fit helps you in labor, which is ultimately the goal of being fit across your pregnancy, that you're successful in your labor journey, whatever that means for your birth experience. But being physically fit, being able to hold squat positions, things like that, help you be more mobile in labor, help reduce pain if you're more mobile during your labor. So definitely you would want to continue to engage in activities that keep you active, keep your muscles engaged, to help you with the ultimate goal of being successful at your birth. And then additionally, if you engage in activities that maybe you weren't so interested in fitness prior to pregnancy, adopting healthful behaviors in pregnancy increases your likelihood that you'll continue them in the postpartum period, which can help with weight loss, return to your pre-pregnancy weight, and help you establish healthy behaviors with your family, so that that continues on when you're outside and active with your new babies. Our next question was, is exercise in pregnancy different? Yes. Like I mentioned before, your center of gravity changes, so that is the thing that you want to be most on the lookout for, is increased risk of falls, because you do have to modify how quickly you transition in positions, in speed, and things like that. As you get more pregnant and your belly starts to extend more forward reaching, it will change how quickly and easily you are able to get up and move around. Besides that, there are some hormones of pregnancy that are super useful for helping prepare your body for labor and birth, but in the interim may offer risk for some increased discomforts of pregnancy, such as hip pain, round ligament pain, and things like that. And that comes from the hormones relaxin, which do a great job of increasing your flexibility in pregnancy. So you may find that if you didn't like yoga before or Pilates, you're really great at stretching right now in pregnancy or as you get more pregnant, and that's awesome, because that's your body's way of preparing for the work of labor. But with that also comes the risk for falls. So you do need to be careful not to do any like singular joint movements like jump squats, jumping lunges, anything that requires shifting of weight to only one side of your body, because it's easy for those joints to become dislocated, like at your hip, if you're putting too much weight bearing activity on one side of the body. So with that being said, definitely continue, take advantage of your increased flexibility, engage in some newer activities that are lower impact. Although I said not to do anything new, like low impact activities, water aerobics, swimming, yoga, Pilates are definitely okay to implement in your new level of physical fitness, primarily because it's not increasing any risk to any contact activities that would cause harm to yourself or your growing baby. The other benefits of exercise in pregnancy include just being aware of like the new demands on your body because of the increased blood volume you have, the work that your body is doing to move that extra blood volume around. So you do have to be aware that you may feel shorter of breath, especially as you get more pregnant and your growing uterus moves up into your thoracic area where your lungs were. So now your lungs feel more kind of compressed. So you may feel like you are shorter of breath as your uterus grows, which again, totally normal, but you do need to modify the intensity of activities if you get to the point where normal activity that you could have done breathlessly before now requires a lot of effort. So across all things in pregnancy, trust your body, trust your intuition. If your body is telling you something does not feel good, stop. And if it persists, you definitely would reach out to one of your providers at our office to kind of discuss the appropriateness of continuing that activity, just so that we make sure you're being safe, as in your home, as well as the times that we're not able to be with you in person. And that leads into our next question. How do you know when to stop? So your body is always the best guide. So no matter what I've said here, if a rate of perceived exertion of 6 to 8 is still really tough for you, trust that your body is telling you to slow down, and you can certainly modify activity as you need to. But big flags include any vaginal bleeding, any abdominal pain, regular painful contractions. Obviously, we're speaking around contractions to someone further along in pregnancy where you can understand what you're feeling. But if you feel anything that feels like pelvic cramping, menstrual cramps, regular organized tightening that is a contraction, you would definitely want to be in touch with us. Sometimes that occurrence is not so much related to the level of physical activity that you've done, but it's also influenced by your level of hydration. So many times if you increase your level of physical fitness, especially on the warmer days here in North Carolina, the humidity plays a huge factor in how much water loss you have, and the more dry your body becomes, it can send signals to your uterus inadvertently, because your body's trying to hold on to excess fluid, that you need to start preparing for labor. So sometimes the simple fix is increasing your water, but you would definitely want to be in touch with us if you feel concerned that your activity increases the frequency at which you're experiencing like uterine tightening, any pelvic concerns. You would definitely want to stop and be in touch with our office if you feel like there's something leaking from your vagina that you know is not urine, and you think maybe your water, because that's definitely something we want to be aware of to help you manage appropriately. And then the more common things, any dizziness, headaches, loss of balance, shortness of breath that doesn't stop when the activity ceases, especially around shortness of breath. Those are more urgent medical concerns, and you would definitely want to reach out to us as soon as possible. If it was shortness of breath or chest pain, if you need to call 911 or visit a hospital, certainly feel free to do that. So after all that, specifics, what are things that you just certainly should avoid in pregnancy? So that would include any activity that would cause bodily contact or harm to you or your growing baby. These activities include contact sports such as football, downhill skiing, snowboarding, scuba diving, rock climbing, any activity above 6,000 feet elevation. So anything that would take you mountain climbing, things like that. Now, if you live at an elevation that's that or above, again, you don't have to modify your daily activities because your body is used to the expectation of work at that elevation, but you do not, again, want to engage in any high-risk contact sports in pregnancy. Just for safety of yourself and for your growing baby, you don't want anything impacting, your body personally that could cause harm to yourself or the baby. So now that I've answered all or most of the questions that we've had around physical fitness in pregnancy, the next part of this session will be kind of showing you activities that you can do at home, modifications that are useful in pregnancy, and then you can decide if you need to modify and at which point you need to do that. Hi guys, as I promised before, just a few exercise examples to show you some things and modifications you can do as you become more pregnant and things need to change. So the first one is a modification for running, not for long distances, obviously, but if running becomes uncomfortable, you can run in place. You can either keep your hands across your chest if you need to, or kind of up at your sides. But this would be for short interval, kind of to increase your heart rate if you're doing a more high intensity interval training session in your home. But again, simple modifications for running in pregnancy. So again, I'll put my hands across my chest, and then you're just going to do high knees at the pace at which you need to. So it can be a slower pace, or if you're comfortable, a faster pace. Now, obviously, that will matter if you have a belly that is, growing with you. The more that your belly is extending forward, the less likely you'll have the mobility to move your knees around it. So make that modification as necessary. The second set of exercises that can be useful in pregnancy are anything that can change something from a high impact activity to low. So again, things that increase your heart rate really easily are things that are cardio, so like jumping jacks, which are safe in pregnancy. So if early, you can just do normal jumping jacks. As you become more pregnant, you can modify to do a step and squat jack. And you can determine the number of sets and reps that you'd like to do. One of the other common concerns in pregnancy is for diastasis recti, which is a separation of your abdominal muscles. So you would want to avoid activities that increase that risk when you're very pregnant. So you may do sit-ups and crunches earlier in pregnancy and then modify, towards the end. Another great ab work activity is a mountain climber. So early in pregnancy, and if your mobility is there, you can certainly do that. So mountain climber. And then as you get more pregnant, you'll need to modify and add some height to that. And then you can just step your knees in. For the pace and the number of reps that you'd like to. Now, everything we're suggesting are just modifications. You can certainly do other activities that you enjoy if you're concerned about whether they're safe in pregnancy or not. If you have access to like a coach from your gym and you can get in touch with them, certainly reach out, but feel free to be in contact with us if you have any concerns. In regards to weight training, that modification will kind of just be based on whether or not you can lift the amount of weight that you were doing before. Most people don't have access to heavy weights in their home, so that would be a simple modification using milk gallon jugs, soup cans, things like that for the number of reps if you were using smaller weights. Sorry, I'm huffing and puffing, so hopefully you will be too after that small demo session. But just know that if you have any questions, we're certainly available to speak with you about how to modify activity across pregnancy, but the ultimate goal is for you to remain active to help prepare yourself for labor. And the other thing to note that when you increase your level of activity, you'll want to make sure you increase your hydration. So, as always, the nurses at the hospital, the nurses and my colleagues at our office know I always have this guy with me. This is a 64-ounce container. So goal in pregnancy is 80 to 100 ounces of water per day. So if you can manage to get, more water in with your physical activity and you start drinking upon waking, you'll likely meet that goal by the end of the night without being angry with me that I told you to drink so much water. You have to pee all night. But we definitely want to make sure you're engaging in physical fitness in a safe and healthy way. So as the weather gets warmer and your activity increases, just make sure you stay hydrated so we can keep you healthy, out of the ER, keep your uterus nice and quiet until it's really time to meet your baby. Thanks for tuning in, guys. Hope to see you on our next Wellness Wednesday. Bye.